I am Dr. Shoaib Padaria. I am Director of the Department of Vascular Sciences and Hyperbaric Medicine at the Jaslok Hospital and Research Center, Mumbai. As we all know that there are lots of blood vessels in the legs. The blood vessels which take the bad blood or the blood vessels which carry less oxygenated blood from the skin towards the heart, they have a series of valves at various levels. These valves ensure that the bad blood goes from the legs up towards the heart. In some people, these valves are weak, and when they start leaking, the flow of blood now is in a reverse direction, in a downward trajectory towards the feet. And this leads to gradual dilatation of the veins and tortuosity of the veins, which people see as green dilated veins in the legs. And these are what we call varicose veins. You'll be surprised to know that varicose veins is an extremely common condition. It is estimated that almost 6% to 7% of the entire population suffer from some sort of varicose veins. And if we translate that to our country, about 84 million people in our country will suffer from varicose veins. These may be very tiny veins which are seen in the thighs or the legs, which are called spider veins, or they may be very, very large veins which are cord-like structures seen in the legs. These veins over a period of time dilate, enlarge, and they can be the cause of much discomfort. They can lead to heaviness in the legs, aches in the legs, cramps in the calves, tiredness while walking, swelling around the ankles, and in later stages of varicose veins, the skin becomes dark, pigmented, and can give rise to venous or what are called varicose ulcers. Occasionally, these ulcers can penetrate up to the bone and can even be responsible for what is called gangrene. So varicose veins is a very, very important condition. Up to now, there were only two methods of treatment available for varicose veins. One is what we call medical line of treatment, in which we used to give some tablets such as MPFF or compression stockings, what we call compression garments or bandages, which would help some patients who had early varicose veins in alleviating their symptoms. When patients had advanced disease, the only option available was open surgery. This involved multiple cuts, multiple surgeries and stitches, required hospital stay for 2 to 3 days, and recovery time of 15 to 20 days. And therefore, this was not a very, very popular option. However, about 14 or 15 years ago, there was introduced a new method of treatment for varicose veins, which we call endovenous ablation for varicose veins. This basically means treatment of varicose veins without any surgical intervention. This is achieved by a number of methods, the most common of which are laser treatment of varicose veins, radiofrequency ablation of varicose veins, and foam sclerotherapy of varicose veins. The main advantage of all these three methods is that there are no cuts or stitches which are required. The procedures are done under local anesthesia using very tiny needles and tiny laser wires, and the entire procedure is completed within a matter of 15 to 20 minutes. The patients are immediately mobile after the treatment, and most patients can return to their regular routine work the very next day. This is especially important in those who are working individuals because there is no loss of manpower, no loss of downtime, and most corporations, organizations prefer this treatment because their workforce can come back to work usually the next day. So let me tell you a little bit about laser therapy of varicose veins. We use something called a diode laser, in which a thin laser fiber, which is only about 600 microns in diameter, is introduced into the vein through a very tiny needle under local anesthetic. Once it reaches the desired area of the vein, which is leaking, laser energy is delivered into the vein. So what we are effectively doing is welding the vein from inside, effectively closing the vein permanently. And then this wire is removed. Different areas of the veins which are leaking are treated in a similar manner. The entire procedure is done under ultrasound guidance so that we know exactly which segments of the veins we are treating. The major advantage of laser therapy of varicose veins is that the recurrence rate of varicose veins over a period of 5 years is only between 2 to 4%, as compared to open surgical methods where the recurrence rate is almost 40 to 50%. And therefore, this basically translates to the fact that patients need to go back to the doctors less often in the future when they develop less number of varicose veins. I am basically an interventional cardiologist and also head the Department of Vascular Interventions at the Jaslok Hospital in Mumbai. Many years ago, I realized that there was no effective therapy for varicose veins, while we had a lot of therapy for arteries. The new technique of endovenous laser treatment achieved US FDA approval in the year 2002. At that point of time, I realized that this is the technology we need to bring into our country. I went and got trained in Germany, and we were the first center in India to start laser therapy for varicose veins on the 6th of January 2003. Our patient was a leading family physician of Mumbai who volunteered for this first therapy, and I'm happy to say that even 14 years later, this doctor is absolutely free of symptoms with no further varicose veins having developed. So over the last so many years, we have treated thousands of patients of varicose veins, and I can confidently say that more than 90 to 95% of these patients have had a good, successful long-term outcome. About 10 years ago, I was also instrumental in setting up the Venous Association of India, which is a group of like-minded doctors who treat varicose veins with endovenous treatment procedures. Today, the strength of the Venous Association of India is more than 400, and these doctors are spread out all over the country, offering state-of-the-art treatment to patients who suffer from varicose veins. We took this a step forward, and we established what is called the Hcl Venous Forum, which is a group of doctors from all over Asia, and I currently hold the position as Vice President of the Hcl Venous Forum. The idea is to spread awareness about this new technique and method of therapy to doctors and patients all over the Asian region. Apart from that, we now have what is called the International Union of Phlebology, which is a group of 125 countries from all over the globe who have joined together to form a basic forum for spreading awareness of varicose veins, and I'm a council member of this particular organization also. The next step forward is to deliver this revolutionary method of treatment to the general population, especially those people who can't afford this treatment in the far-flung rural areas of our country. Varicose veins is a very common problem, can affect farmers and anybody who stands for long periods of time. Our initiative is to form an NGO which will be helpful in delivering free or very highly subsidized laser treatment for varicose veins to deserving members of our country, to deserving citizens of our country. And to this effect, we have our volunteers from the Venous Association of India who will give their time free of cost, their equipment free of cost to help these patients. I appeal to members of the government in our country at every individual state to help us to achieve this goal of ours.